2 years after the National Tobacco Control Bill was passed into law in Nigeria, the government is set to come up with stipulated guidelines to make its implementation possible. We caught up with an anti-tobacco activist, the West African sub-regional coordinator of the Campaign for Tobacco-Free Kids, Hilda Ochefu. On this interview segment, she spoke to us on a number of things, including the activities of CTFK in Nigeria and the need for government to speed up the guidelines for implementation of the National Tobacco Control Law.
For the Campaign for Tobacco-Free Kids, our vision is a world where our kids are safe from the harms of tobacco. Because we all know that I think most people are now aware about the dangers of tobacco, that it causes disease, it causes disability, it causes death. So our vision is to see a world of where tobacco is effectively regulated to ensure that our kids are protected. That's still our vision for Nigeria. We would like a vision of Nigeria where kids are protected. All citizens actually, not just kids, all citizens are protected from the harms of tobacco. We would like to, our vision for Nigeria is a Nigeria where kids do not pick up the bad habits of smoking. Because we are very much aware that smoking is the first step into the use of hard drugs and other, of course, that results in vices as well. In Africa right now, for the Campaign for Tobacco-Free Kids, we work in 10 countries. Right now in West Africa, we work in Nigeria, where I'm based, and we work in Ghana and Cameroon. And then in Francophone Africa, we work in Senegal, DRC, Democratic Republic of Congo, and Togo. In East Africa, we work in Kenya, in Uganda, and Ethiopia. And we also, the 10th country is Botswana. So in these countries, each one of them, we're supporting civil society groups and the government to either pass legislation on tobacco control or implement effectively their legislations, their acts or laws in these 10 countries. I must say that Nigeria, in the last 4 to 5 years, Africa has made a lot of progress in passing tobacco control legislations. In some of these countries, they're either now implementing, like Nigeria, or they're still trying to get their laws passed, like in Botswana and in Cameroon. So we are seeing some progress, but we would like to see more progress, more African countries actually going ahead to pass laws, and not just pass laws, but also implement these laws. But strong laws are really critical, because if laws are weak, then those laws are not going to have the desired impact, which is to protect people, citizens of those countries from the harms of tobacco. Nigeria signed the WHO FCTC Framework Convention on Tobacco Control in 2004 and ratified in 2005. So it took Nigeria 10 years actually to get the National Tobacco Control Act in place. And that was in 2015, May 26th, it was signed, the act was signed. So since then, implementation has been slow. There hasn't been full implementation of the NTC Act because the Act requires that regulations have to be developed by the Ministry of Health, Federal Ministry of Health, and sent back to the National Assembly for approval before the Act can be fully implemented. Some parts of the Act are being implemented actually. For example, the setting up of the National Tobacco Control Committee. The committee has been set up, is up and running at the moment, but most provisions of that Act, most provisions are not being implemented because the regulations are not ready. So we're aware that the Federal Ministry of Health is working really hard to make sure that those regulations are developed as soon as possible and sent to the National Assembly for approval as soon as possible. It's important for me to mention that in the last 2 years that this Act has been in place, and it has not been implemented fully. Every single day, young people, our kids are being addicted to tobacco. More and more children are picking up the habits of tobacco smoking, and more Nigerians, especially young people, are being exposed to the effects of secondhand smoke, which of course, as you're aware, causes all sorts of cancers and all sorts of illnesses, especially in young people, in children. So we would like to see the NTC Act effectively implemented as soon as possible. We want to see the Ministry of Health leading the implementation of the NTC Act so that Nigerians can be protected from the effects of tobacco. Okay, so for us advocates, we've been really hoping and pushing and pressuring and supporting the Ministry of Health to move forward very quickly on this. We're aware that they are working, we've been informed that they're working on the regulations, and those regulations will soon be sent to the National Assembly. What we would like to see is for this to be done like tomorrow, because these regulations are long overdue. They should have gone and they should have been actually passed by now.
Thank you so much.
Thank you so much for having me.
It's been a pleasure speaking with you.
Pleasure is mine. Thank you.